Hi everyone. Now we are going to discuss the topic that is test for tubal potency. Test for tubal potency. That is the tube which is used to carry the sperm. Means if the problem can occur in the tube, that is fallopian tubes, which are the methods we are going to use. With that method will help to find out the diagnosis. First thing is Rubin test. Rubin test. See, Rubin test is not used nowadays, so just you have to know that's all, but not that much important. Rubin test, we are passing CO2 gas in that tube, and we will find out the conditions. That is the Rubin test. Don't forget Rubin test also. You have to know passing CO2 gas and to find out the any detection in the fallopian tube. And the next thing is HSG, hysterosalpingography. HSG means hysterosalpingography. See, normally uterus is a triangular in shape. This method we are doing with an radio opaque dye. So test for fallopian tubes, that is HSG, hysterosalpingography. So hysterosalpingography we are providing, or we are proceed with the test by an radio opaque dye. See, normally uterus is a triangular shape, and this is the fallopian tube, and this is the ovary. If I will insert the radio opaque dye in the uterus, it will come, and then it will stay in the ovary, and these dyes stay in the pelvic regions also. That is split. So if I am insert radio opaque dye in a normal ovary, it will give the split form. I am speaking about the normal condition. So before doing HSC, that's a very important. Before doing HSC, HSG, I must give antispasmodic drug or antispastic drug to the patient. Antispasmodic drug or antispastic drug to the patient. This is a very important question. Before doing HSC, we must give antispastic drug to the patient. Why we give this drug to the patient before doing HSC? See, normally if I am entering the dye in the uterus, the dye should pass to the fallopian tube. So before entering the fallopian tubes, normally the body will prevent it, because body doesn't know this is which one is dye and which one is something will come out from the body. So what normally will do, normally this region will block, these two region, that is both things, bilateral cornual spasm. Bilateral, both side. Cornual means the fallopian tube in the corner part, and the spasm constriction. So when I am inserting the dye, it will make an block area in the cornual regions. So if I am inserting the dye, without giving this drug, I can't find out is it happened because of constriction of this part, or really if something will leads to this condition. It means the fibroids. If fibroids will there, the dyes can't enter into the fallopian tube. So if you will find out the film defect, film defects, that is fibroids and then polyps. So when you find the honeycomb appearance, that is intrauterine adhesion. that is intrauterine adhesion. So film defect when you find on the HSC, that's represented fibroids and polyps. When you find the honeycomb appearance, that is intrauterine adhesions. So before doing HSC you have to give antispasmodic drugs to prevent the bilateral carnoval spasm. Even if you are giving the dice, after that also the constriction happens, sure the patient have really problems. Now when now we all know HSC, how we can proceed and what you should do. So we have to know the main thing, when you will do this test for the patient. When you will do this, see, this test will you do on 8th or 9th day after menstruation. 8th to 9th day after menstruation. That is the main thing. Don't do HSC before menstruation. Before menstruation. Before menstruation or premenstrually. Menstrually. Of post menstruation. Of post menstruation. That's the main thing. You can get the question when you will do or when you will proceed the HSC on the 8th to 9th day of menstruation. That's post menstruation, but before menstruation or pre-menstruation is fully contraindicated. Contraindicated because 21st day the implantation can be possible to occur. That's why if you are doing before menstruation, it will disturb that. That's why we are proceeding this test after menstruation, that is 8th to 9th day. Very, very important question. Very, very important question. So first thing we studied the Rubin test, and the second thing HSG. And the second thing HSC. Now we are moving the third thing, that is SIS, saline infusion sonography. See, normally we can't see anything while we are doing an USG, ultrasonography. Ultrasonography, we can't find out anything in the tubal potency. So we are using the saline solution with ultrasonography, that is saline infusion sonography. Saline infusion sonography. How we can use? We can use USG plus saline solution. We are giving the saline solution to the fallopian tube and then we will do the USG. Next thing is hysterosalpingo contrast sonography. Hysterosalpingo contrast sonography. We are providing this test by an galactose solution. Galactose solution with galactose. Galactose solution with galactose. So first thing we are studying HSC, and second thing SIS, and third thing is HSCS. HSCS. Hysterosalpingo contrast sonography. And the next thing, that is laparoscopic. Laparoscopic. We are doing laparoscopic by an chromopertubation. Chromopertubation. See, we are using this condition by an methylene blue dye. Methylene blue dye. Methylene blue dye. The same thing. This is the uterus. Sorry, this is the uterus, fallopian tube, and the ovary. When I am entering the methylene blue dye, that is methylene blue dye, the same thing it will come and the split can appears. split can appear, but the laparoscopy method I can see very clearly in the exterior part of fallopian tube. Exterior part of fallopian tube. So laparoscopic I am using by an methylene blue dye method, but I can easily find any detection very clearly in the only in the exterior part of the fallopian tube. In the question maybe they can ask if you have any problem in the outside of the fallopian tube, with the method you can proceed to find out this condition. That time you can choose laparoscopic method. And the next thing is falloscopy, and next thing is falloscopy and salpingoscopy. Falloscopy and salpingoscopy. See, falloscopy we can see the cornual site, and the salpingoscopy help to see the till fimbriae part. Till fimbriae part. Fimbriae is present near the ovary. So these two methods help to see the interior part of fallopian tube. Interior part of fallopian tube. So laparoscopic method helps to see the exterior part of the fallopian tube. Now the falloscopy and salpingoscopy. Falloscopy you can see the cornual site till, and the salpingoscopy you can see till the fimbriae. These both methods help to see the interior part of the fallopian tube. So if the question, the same thing like an laparoscopic, if you have find any detection in the interior part of the fallopian tube, which method helps to find out this condition, or what should you do for the future diagnosis, you can choose falloscopy or salpingoscopy. So these all the method comes under the tubal potency. First we studied the HSG, hysterosalpingography. That's a very important, that's the two main question which day you have to perform the HSG, that is 8th to 9th after menstruation. And what should you do before the HSG, that is you are giving the anti-spastic drugs to prevent the bilateral cornual spasm. Second thing we studied SIS, saline infusion salpingography, and third thing is hysterosalpingo contrast sonography, and the fourth thing we are doing the laparoscopic, and the fifth thing falloscopic and salpingoscopy. Falloscopy we are seeing the cornual site, and salpingoscopy you can see the interior part of the, these two conditions helps to see the interior part of the fallopian tube, and laparoscopy is the exterior part of the fallopian tube. These are the conditions we have to know the tubal potency. Hope you like this video. If you like this video, do like, comment and share, and don't forget to subscribe my channel. Thank you so much.